My name is Kayla Bain. I'm going to be doing my skills validation for clean catch urine from a foley cath and also my removal of a foley cath. And I'm going to do my 360 of the room. Before I'd even enter the patient's room, I'd want to check in the patient's chart in the MAR that there is an order for urine collection from the foley catheter. I'd want to make sure that I have the correct physician ordering, correct date and time, the correct patient. I'd gather my supplies, and then I'd go to the patient's room, introduce myself as the patient's nurse, explain the procedure that I'm going to do, wash my hands. I'd want to make sure that I'd bring with me a sterile specimen cup, a 3 ml syringe to withdraw the urine from the cath. You also want to make sure that you bring some kind of chuck or a drape or something to place under the patient or near the patient's urinary meatus, just in case there is dribbling, that it does catch that and doesn't get all over the place. I'm also going to take with me a Sharpie marker to write on the patient's specimen cup to make sure that it is the correct patient and information on the cup, and also a alcohol swab, alcohol wipe. I would take my stuff into the patient's room. Before I do anything, I would label the patient's cup with their name, the date, the time. If I know their MRN, I put their MRN, their room number if I have it, the doctor ordering, and their date of birth. I'm going to label it with the time of collection when I do collect it, and I'll also put my my initials on it. So I've explained to the patient what I'm going to do. I'm going to put on clean gloves. I'm going to pull back the patient's blanket or robe. First you want to check to see if there is any urine in the tubing of the catheter, and if there is not, you do want to clamp it. You clamp it by going like this. Make sure not to be pulling on the catheter, just so it's not any discomfort for the patient. You'd want to leave that clamped for 15 to 30 minutes, definitely no longer than 30, otherwise it can cause problems for the patient. After you come back 15-20 minutes, you will see urine collected in the tubing. At that time, you want to get your alcohol swab and swab the port to clean it. You want to let it dry for just a little bit. I should have done this before. So I'm going to swab this one more time, just for good measure. Remove the cap. You're going to want to go down at a downward angle, just making sure not to pierce the tube. Withdraw however amount of urine that is on the order. Usually it's 3 to 5 milliliters. And get your cup. It's best to keep it on a flat surface and keep the cup cover at an angle. Put your urine in. Cap the needle. Put the cover on. Make sure to cover up your patient to provide privacy. And put the time of collection in your initials. You want to get this to the lab within 15 minutes to ensure that it is an accurate specimen. And at this time there also is an order to DC the foley catheter. So again, I've checked my MAR and my orders from the doctor to make sure that it's the correct patient, correct time, correct date and everything to make sure that it is supposed to be removed. So again, I'm going to pull that back. I'm going to want to have a 10 milliliter syringe. You are going to want to double check to make sure what amount of saline is in your balloon of that catheter. It does depend on each individual catheter, but this one is a 10 milliliter. You do not have to swab anything because we are discontinuing it, so it's not sterile. going to want to take your saline out. And the plunger of the syringe should pull back because as the saline is trying to get out, it will push it back. Okay, and all my saline is out. Pull that aside. I am going to take this tape off without pulling on the catheter at this time. You're going to want to tell the patient to take a deep breath as you're pulling it out because it's probably not going to be the most comfortable thing in the world. So you're going to pull this out, holding it up. And you're going to want to make sure that your catheter is intact to make sure that there's nothing left behind. This catheter is intact. You're going to want to grab your tubing. And all this is going to go in a biohazard bag because it does have body fluids. And that is the end of my video validation.